Hi everyone, this is Kathy Inglad. Welcome to the Top Lessons. I wanted to start a quick note so that you all are aware that this podcast will be slightly longer than the rest. And the reason why is women's health, obesity medicine, and generational wellness is a topic that is near and dear to my heart. And I wanted to take the ample opportunity to ensure that we don't cut out any of the top lessons that are discussed in the podcast with Dr. Iman Saleh. So please ensure you listen. If you need to put it on hold, take the time to listen to it in parts if needed. But I'm so excited and so inspired that you all can listen and ensure that you all get your annual checkups if needed, if you haven't done so yet, but also start the year off with a healthy mindset. Thank you so much for listening, and I hope you enjoy. Thanks.
Hi, everyone. Welcome to another lesson on the Top Lessons podcast. I'm your host, Kathy Inglad, and with me today, I have a very special guest. She is not only an board-certified OBGYN physician, but she is also one of my good friends for the last 20 plus years. Welcome, Dr. Iman Saleh.
Thank you, Kathy. Yeah. Oh my God. When I hear last 20 years,
we won't count exactly how many years, but there's definitely 2 decades more.
It's a lifetime for sure.
Yeah. So Dr. Iman Saleh comes to us as a very accomplished and reputable OBGYN who practices in Suffolk County. Now, for those of you that do not know where Suffolk County is, it is in Long Island, New York, and she practices at the Northwell Health Physician Partners group. And she comes to us with a vast expertise of not only OBGYN health, women's wellness, but also a new practice of obesity health. Now, you have been in this practice, again, for over a decade, probably close to 2 decades now. And you are, again, a very accomplished OBGYN. But we're bringing you here to discuss something that I think is very important. So to all my female friends out there, I hope you pay attention to this podcast, but also share it with your friends, your moms, your cousins, your wives, whoever it is, to ensure that they listen to the lessons we're about to discuss. So you have been in this practice and you have been an advocate for women's health, and you have dedicated by providing the most preventative health wellness education that you can bring. What lessons have you seen in your area of expertise that you want to share about women's overall wellness, but also the wellness of obesity medicine and what that does to women from childhood all the way through the menopause stage?
Oh, so the first thing I think, the first piece of information I want to share is that we as women need to take care of ourselves,
Yes.
right? The well visit for women, right, should not be just brushed off and said, oh God, you know what? I went to my primary care. We're all good. There are certain topics that a woman feels more comfortable speaking to about with a gynecologist. There are topics that gynecology makes a safe space to talk about, right? So it can be issues with your menstruation. It can be not being able to conceive. It can be postmenopausal symptoms, the hot flashes, the anxiety, and also kind of even as much as urinary incontinence. These are topics that are unfortunately people kind of push back in terms of sharing because they're so sensitive topics and they're very personal topics. So that's key. I think it's key to make a friend with your gynecologist, not every day, right? But a key to come and be able to talk and share what you're feeling and going through as we go through stages of life. We as females go through multiple stages, and every stage of our life has a concern or a symptom or something that's, wait a minute, this doesn't sound normal to me.
Correct.
Can someone help me with that? In terms of obesity medicine, obesity medicine came into light way before the medications, which I'm sure we'll be speaking about. Obesity medicine focuses on more, in my eyes, as an OBGYN and a specialist in obesity medicine, is that obesity affects us throughout from childhood all the way to menopausal, even postmenopausal. And it's not about being vain, okay? It's not about being thin or the perfect figure like everyone on TV, but also about taking care of our health. Obesity has a big factor in terms of our health. The other component I want to, tell you about obesity is that it's not about just eating right or exercising. a lot of us, including myself, I've been obese for a while and struggled with that mentality, especially younger. Well, if you ate a little less, maybe you'd lose the weight. But we're coming into light now, seeing that there's other factors that we can't control.
Correct.
There's hormonal, there's genetics, there's environmental, things that we cannot control just with the lack of or decrease of eating and more exercise.
Yeah, it's like no matter how many hours you can be at a gym, sometimes you're predisposed to those genetic factors that your parents gave you as a gift.
Correct. Absolutely.
And you're you have to take then that extra care to go to that doctor to say, how do I overcome these obstacles?
Correct.
To be able to then know that, the gym won't work for you. Or maybe the gym will work, but you need 6 other things to go along with that. And I love the fact that you said you can't be vain. I think we all have this, especially now, and we'll touch upon the, GLP-1s injectables in a second. But, you want to look a certain mold where society puts you in that mold. And I think now, and I loved the fact that a lot of companies now are breaking out of those molds and they're saying, what is okay now is every size and every shape and every color that there is, and they're no longer the Cindy Crawford models from the 90s.
Right.
But we also have to make sure that we're healthy inside. That outside shell that we have, whether it's a size 2 or a size 12, you have to be healthy. And I think this is one of my personal opinion to all of you out there, is a personal opinion of mine, is these injectables may make you look a certain size, but we don't know what's going to happen years down the line.
I think we kind of do know what's going to happen, or have a glimpse, I should say, not full.
Yeah.
These medications, I've been practicing obesity medicine for almost 4 or 5 years right now, and these have changed people's lives, right? There are patients that have been almost ready to go to bariatric surgery to get a life-changing experience because they're unhappy with what they look like, right? Which, again, it's not about the vain part. But they have increased disposition for diabetes, hypertension, cardiac disease, strokes, right? And these medications have made them be able to change their lifestyle, because it's not only medication, right? We have to look at it. It's just, it's not a magic pill. Yeah. Everyone thinks, I want that injectable. I want to lose that 50, 70, 80 pounds. But it's in combination with lifestyle changes, meaning healthy eating, exercise, and these medications. But we're also seeing that the people that are on these medications, cardiovascular-wise, or their heart health, actually improves.
Yeah.
So that kind of increases their longevity and also decreases their risk of diseases that they could have had down the line.
Yeah. No, that's great. And I think the aspect, and I had, a celebrity fitness trainer already on the show. And like anything else, his message was consistency and making sure you are doing the right workout, whatever the workout is for you. But you also have to be internally healthy, not externally just look like you're good. Whether it's the injectable, but it's also you can't go out and eat, 6 steaks, the same day.
You're going to feel
drink,
like crap,
drink,
excuse the language.
The sodas to a maximum limit, right? Yeah. It's like it's not giving you that out of everything else that you, especially as a doctor, expect your patients to do and listen to.
Yeah. I mean, these medications do have side effects, right? So if you are anticipating to get these injectables and have the 6 steaks or have a big ribs meal or heavy sugar-filled meal, you're going to feel sick, right? So it's not in lieu of exercise and eating well and making conscientious decisions. It's in combination. Yeah. But some people even besides that layer, have this constant food noise, right? What we call food noise is that you're always thinking about food. You just had your meal, but what am I having? Wait, I'm kind of hungry. Maybe I have a snack. Maybe I want this. These medications shut off that receptor to allow them to say, okay, I can have my 3 meals. I can have my 3 meals and a couple of snacks, but I'm not constantly thinking, or my day is not revolving around food and what I want and what I need.
No, that's actually, I've been there.
I think all of us have.
Yeah, for sure. Obviously, women's wellness is something that has been top of mind for not just newspapers and headlines over the last election, whether it's, Roe v. Wade being overturned, or whether it's women's wellness overall for, conception and infertility issues. But you obviously are a gynecology and obstetrics doctor, and you have delivered babies, brought in actual life, where my constant joke is, I'm not saving a life, where in your case, you actually are sometimes saving and bringing a life in. Kudos to you.
Yeah.
And we've talked about this, your women advocacy for wellness is something that I think a lot of us forget because we're so busy in our daily life. You're a mom, you're a wife, you're a corporate executive, whether you're the sister or the mom that's been taking care of the family, you kind of forget your own wellness. What lesson have you learned in your expertise that reshifts that expertise to say, don't forget about yourself first? Like, you have to be first yourself healthy to be able to take care of all the people around you. How do you think that is important to what you've seen? Because if we put that off a year or 2 or 3 down the line, we could have caught something. Mm-hmm. Or we could have been preventative in certain cases or aspects. What lesson do you think that has taught you as a doctor on the other side to say, oh, I wish you came to me sooner?
As females, as women that play multiple roles, right? Everyone plays not one role. We play multiple, whether it's mothers, like you said, corporate executive, an aunt, a daughter, a sister, right? We're the core. We're a core of any relationship that we are a part of, and we need to be healthy in order to be that core. In addition to that, I think we kind of forget also is that being the core, right, and being even people who are interested in motherhood or are mothers, right, we biologically have a big effect on how we shape our kids and what their future will be like. Yeah. So, for instance, in people who have obesity, right, even when a female is pregnant, there are some biological changes that can have metabolic effects on the baby to predispose them for obesity or eating disorders. So we need to kind of focus on ourselves because it's not only just ourselves, right? You're focusing, that kind of filters down to every relationship that you have. In addition to the future generations of our children, which, with the obesity epidemic, both in childhood and adolescent, which is much larger than adults, we as females have a huge role to play in that.
Yes. And I think you are a mom to 3-year-old twins.
Yes, I am.
And, I've seen you give them snacks,
mm-hmm.
and they're very healthy snacks. They're fruit, they're veggies, but you also are a working mom. How do you juggle being that mom that brings wellness to your children, but also teaches them eating good habits, and it's not just takeout every night?
It's a struggle. And I think every working woman has that struggle. My kids are definitely not eating fruits and vegetables every day, but we do have our snacks. We have our goldfish. We have our random childhood snacks that we've all enjoyed and the kids still enjoy. I think it takes a lot of effort in terms of kind of prepping or kind of having an idea of what quick meals to make.
Yeah.
I'm not making gourmet meals every day. There's nothing. There's just standard. There's a vegetable. There's a protein, kind of that, like that. And there's takeout. I mean, by far everyone has takeout, but I think just limiting it and knowing that these stuff need to be in moderation rather than being the whole meal or rather being all our meals, right? Working in moderation, saying, no, well, today we're going to do this. We're going to have a cucumber instead of, jelly beans or whatever, whatever candy they want in life. It's a struggle. It's definitely a struggle. I am not perfect at it. It's a work in progress.
No one is perfect.
There are weeks like I feel like I've done it. I've kind of combated. I have all my everything prepped and ready to go. I've had a good week, and some weeks are just it's kind of surviving. Let's figure out what there is.
We are there with you, and to everyone who is a mom on top of everything else, mm-hmm. I think everyone deserves a pat on the back and says, you're okay, you're doing this. No one's going to be perfect. No one expects perfection. But what you want at least is the ability to say, your weight control mm-hmm. happened to be conscious decisions and not something that you just cared about in January when the New Year resolution came. And obviously for you, it is also your career. We talk about medicine as a, preventative measure. And I think a lot of doctors are trying, or at least trying consciously to be more preventative, to say, we don't want you sick. We want you to be healthy, and we'll just, ensure that, that wellness check every year keeps you on that health track. But what do you think is something that you have learned, obviously, as an advocate for generational wellness? And how do we ensure that we just care about ourselves, not at a certain point in time where we're thinking about children and fertility, where, that is important, but we could have done that 10 years ago, where we should have been talking to our OBGYN earlier on to say, what do I need to care about now so I can have those healthy fertility discussions later? But as women, we also, may put off those visits once a year because we feel fine. We don't, we're not feeling anything abnormal or sick, and we're just busy. What lesson do you think we can learn from someone on the opposite side with your concerns that you have seen that helps think about fertility earlier as, as we're growing into becoming mothers? Obviously, I could say is I'm not a mom and I'm in my early 40s, but I also know what risks that comes with. But I also know I've talked to my OBGYN and I've had those discussions, and I'm well aware of the risks that come with being an older mother. But now there's more of a trend to IVF and discussions with IVF earlier. Where do you think we need to start having those conversations with our OBGYNs to talk about fertility and also the issues that obesity has on fertility?
I think we have to start pretty young. I have patients that tell me, oh, I have a daughter who's 15, 16. Should I bring her in? Sure. You know, I think the key with going to a gynecologist, you need to have the right rapport, right? Yeah. You need to be friendly with them. You need to click, right? Correct. So that we can have an open and honest discussion. Some girls do not get their period on a regular basis, right? Yeah. So, and they think it's normal. They can go a month, 2 months, 3 months without having a period. And, yes, there can be other reasons why they don't get a period, or there can be, they might be later on diagnosed with something called polycystic ovarian syndrome, which has its own symptomology, but also long-term effects on them. So, for instance, PCOS, which is the polycystic ovarian syndrome, can have with irregular periods. It can have decreased fertility, right? They have also an increased insulin resistance, which kind of predisposes them to other issues, right, with diabetes and heart disease down the line. So starting early, we not only necessarily just focusing on the GYN part, but also they need to know their risk factors later on with just living a healthy lifestyle. So this, in terms of that, and we don't have to have that discussion in terms about fertility being young, because no 16-year-old is thinking about pregnancy, right? But as they get into later years, we kind of touch base on that, that it's not a sentence like you're not going to get pregnant. No, I have a lot of patients that have that syndrome and get pregnant immediately. Some people do need assistance, right? In terms of the obesity and then the preconception, we should say, or the fertility part of it, there is IVF, right? These are great sources and great physicians that we use and refer to on a daily basis. I do. But they also come with risk factors. Yeah. And they also come with limitations. A lot of these IVF places now and facilities do have a BMI cutoff, meaning a body mass index, meaning you need to be a certain weight category in order for them to proceed. Yeah. Just because there is a failure rate with the IVF, then there's also risks of the procedure itself. And also, even if a female decreases her body weight by 10%, that makes a huge difference in her pregnancy outcomes. So in terms of pregnancy outcomes or risk factors with obesity, there's high blood pressure, there's preeclampsia, right, that affects the mom, but also affects the growth of the baby, which just means that they can get fetal growth restricting, meaning on the smaller side. That also puts the mom at risk for preterm delivery, that she delivers earlier than her usual date. It increases gestational diabetes. Now, gestational diabetes, yes, it's diabetes during pregnancy, but it's not limited to pregnancy. Now, these patients have increased risk going forward for diabetes. Yeah. So if we can decrease those risks, even with, it's like I said, it's 5 to 10% weight loss, that's a huge difference in that. But absolutely.
Now, you were recently mentioned in People magazine for your research on GLP-1 and that linkage to fertility. which I did not know prior to reading the article itself, which I think, maybe medical researchers knew, but I was like shocked as to the connection between the two. Yeah. And I think that goes back to the point that you just made, that once you have weight management under control, you have an increase in fertility, which I think is a great, story to tell people if they're having weight management issues, that if you're struggling to have a child and you want to have that child, that you may consider, an injectable that, depending upon your circumstances, obviously, and your medical doctor. Again, my personal opinion, not the advice of a doctor. You may have success having fertility success. But at the same time, I think it was linkage that before was a mate. And I think your article kind of, gave that aha moment to a lot of people to say, hey, maybe there is a path for me to have children if I go down this road. Have you seen that influx of people coming to your office to say all of a sudden, hey, doc, what's this? Can I try?
I mean, I've seen an influx of saying, oh, my God, I'm pregnant.
Oh, yeah.
And I have my Ozempic baby, right? That's the
term?
The term that's coined. That's my Ozempic baby. And it's not necessarily just because of the medication. It's just the medication itself decreases insulin resistance, decreases your weight, right? So as you do this, the insulin and our fat cells have a role to play on our ovaries. So as we decrease our weight, it's not surprisingly that these people get pregnant.
Yeah. So your body goes into drive in the right direction to then have another child, or to at least be able to, calm all the other issues you had. Correct. And put them out of the way so that now I could focus on fertility.
Yeah. And even with the weight loss with these medications, some patients that have not had regular menstrual cycles now are having regular menstrual cycles, right? So with the regular menstrual cycles, with the decrease of insulin resistance in our body, our ovaries are kind of working now. We have ovulation, right? There's an increased chance of getting pregnant. So these are where everyone is like, oh, that's where my Ozempic baby is coming from. We don't recommend that you are on Ozempic or, Ozempic is the diabetic medication. Correct. But we usually use for weight management Wegovy and Zepbound, which are very counterparts of Ozempic and Mounjaro. But we don't recommend getting pregnant on them, right? We don't know enough studies on how these medications work on pregnancy or the risks of the fetus. So what we ask is that people use these medications with a contraception. That's the recommended use. And when you are ready to say, okay, I'm ready to get pregnant, to get off of them, anywhere from 2 to 3 months prior to that. Yeah. But even that, few pounds, I've seen people lose 15 pounds and get pregnant. It's a little touch of our body kind of getting back to the hemostasis of it, saying, okay, I'm ready to be able to ovulate and change.
Yeah, no, that's perfect. Now we're going to take a little shift into women's wellness because I think you deserve to have this called out as an accomplishment, especially because you come from a culture that has been, I think, historically underrepresented in your field. You grew up in Queens. Shout out to Queens for everyone out there. So did I. This is how we met. But also we met in high school. Yes. The Mary Lewis Academy. So for any grads out there, it is a great school to go to in Jamaica Estates. You decided to go into the medical field a long time ago. Mm-hmm. You had your sights set on medicine since high school. Yeah. And obviously I know your parents had a lot to do with that. But you also come from an Arabic culture. You are fluent in Arabic. And since I've known you, that has allowed you to kind of have your own almost following of Arabic women who trust you and respect you, especially for, obviously your OBGYN physician status. And they're coming to you to be that trusted doctor. Mm-hmm. Can you talk a little bit about how your parents have inspired you to go down to the medical field, but also what the Arabic culture and the community has done as a following to, support you in medicine, and how, the culture also inspires you to be that kind of, person that they go to where they feel comfortable and safe to open up with you?
Mm-hmm. So my path started, I guess, pretty young. My parents are both immigrants from Egypt. So we were first generation. And as first generation, there was a lot of pressure on us that we needed to make it, right? And it's not because we needed to prove anything. Correct. But I think also the fear of our parents raising children in an unknown world, right? They didn't have the extended family to rely on, or the system that they knew in order to do that. Growing up, we as Arabs did not have much representation, right? In anything, even more so the medical world. Yeah. And that is where my parents had instilled, you know what, maybe you should go into medicine. Be that face that you can represent, right? Be that familiar face that patients can come to, right? Your own people, your own language, your own culture, that you would understand them and they would understand you. But also more so women's health, right? Women's health has swung a pendulum, but previously it was a male-dominant field. A lot of women of Arab descent are uncomfortable going to males. A lot of their spouses are uncomfortable of these, because since it's such a sensitive topic, right, and of our body, are uncomfortable for their wives and their sisters and their cousins to go to see a male gynecologist. So that's where I was really pushed into terms of saying, listen, our women need this guidance. Our women need this representation. And that's where it kind of stemmed out, and it was basically a snowball effect, right? It went from high school. We were at the Mary Louis Academy. I started this Bridge to Medicine program while I was in high school. I went to Sophie Davis School of Biomedical Education, which was at that time for minorities. Correct. To increase the representation there in medicine. And I continued to pursue my medical school and then residency in obstetrics and gynecology. I think it gives me a little edge when I speak to my Arab patients, because I know what the culture is. I know what is right to say, what's not to say, what to touch on that they may be shying away from because of the culture of being taboo. And also allows me to say, hey, I don't want to just see you next pregnancy, right? A lot of these women just go from pregnancy to pregnancy and don't have that middle ground in preventative care, right? They're not aware of what risks we have.
And again, you're speaking solely on your culture, but that I think is pervasive among a lot of women, especially women who are, shy or immigrants. They kind of think that they're saving themselves a little bit of extra money by not going to that follow-up visit. But really it's you're taking a chance and you're rolling the dice on your health, because Absolutely. You're going from preventative to then being reactive, and then having those, I could have caught it earlier conversations if you just went to those annual checkups.
Absolutely.
We talked about this, and, especially cancer and cancer of all types has shown up in cases where there is no predisposed family linkage. I know we talked about this. Doctors ask you, what is your history with cancer in your family? And I know you say that's a very important question to ask.
Absolutely.
And we'll go into that in a second. But I think for me, it's also knowing that you could have a cancer no one in your family had before. Mm-hmm. And how do you ensure that you catch that in the earliest of its stages before it becomes inoperable or, not something that could actually be solved? But at the same time, we talked about cervical cancer, how it could be caught earlier if you just went and got those tests that are annual physical tests.
Absolutely.
So talk a little bit about that prevention, about cancer, and asking those questions about what is your family history.
To me, family history is important as well. Okay. I agree with you 100% in terms of we are seeing a lot of spontaneous cancers. Okay. Now we have an increased rise of breast cancer across the board. It is not limited to older women anymore. Correct. We are seeing girls in their late 20s, early 30s in terms of doing this, or being affected by breast cancer. With that, right, it may be genetic, it may not be genetic, right. But also it affects everyone around them, right? Yeah. So when someone is positive, then you start saying, wait a minute, does someone else need to be checked? Does my sister need to be checked? Does my aunt need to be checked? Do I have to ask my mother history?
Yeah.
But it's important to be preventative, right? So the key of preventative medicine, right, is to just make sure you check the box that everything is fine. Yes, some of us kind of know how to do a breast exam, not know how to do a breast exam. Some of us are too shy to do a breast exam. We don't want to do a breast exam on ourselves. So that's where the key points come in the routine gynecological visits, right? You go through everything. Yes, we go through a family history to make sure that we are not missing anything.
Yeah.
But also there's advances in sciences now that we can do blood work to see if you have a predisposition in terms of blood work, in terms of certain genes. with those certain genes, right, you might be given a certain recommendation or increased surveillance in order to decrease your chances of having this or finding this early, God forbid there is something. You know, we do breast cancer, we do colon cancer screening, right? We do rectal exams, we push for colonoscopies. That's another reminder. Yeah. Hey, did you get your colonoscopy? Not yet. Oh, it's time to go. Referral. Pelvic health, right? Pelvic health is very important in terms of endometrial cancer, right? Ovarian cancer. You know, endometrial cancer with the rise of obesity, with our weight, our fat cells actually produce extra insulin on top of what our body does. So that affects our uterine lining that can predispose patients in terms of endometrial cancer. If you're having irregular bleeding and you're kind of like, oh, maybe it's just my period, well, maybe it should get evaluated. So that's where we have those discussions. And lastly, like you said, cervical cancer is a preventative cancer. Yeah. It is not genetically disposition. It's from the HPV virus. So doing the pap smears is very important to see that. There's also, besides that, you know, there's vulvar cancer, there's vaginal cancer. Those all can be seen, right, and evaluated and make sure that everything is fine. So preventative covers from top to bottom. It's not just the pelvis below. Correct. Also, with the family history, you know, family history can be used just to calculate your risk. Doesn't necessarily mean you're going to have something, correct, but it can calculate your risk. Wait, are we at an increased risk, or are we like at a moderate risk or general population risk? And from there, we can kind of guide in terms of certain surveillances that we can do. Yeah, you don't need to do all of them, right? There are some of them that are very drastic, you know, and it may not be age appropriate at that time, but absolutely that you would have that in mind to kind of say, okay, I need to be mindful of it.
Yeah, and I think for all the women that are listening, and hopefully, you know, the lessons here will stay with you, is that self-care matters. You can't just leave it up to the one day you wake up and you feel something on the side, or you know something is hurting you, or that feeling that something may be off, but you're just putting it aside because you're busy. And whether you're, you know, in a demanding role at home or at work or in both, there's certain medical guidelines that tell you an annual visit is at least what you should be doing. And we put them off. But I think we have to circle back to that self-care reminder. If you're not okay yourself, you can't take care of the people around you. And the people around you who rely on you because you may be their only, you know, dependent caretaker, really want you to be healthy. And women's wellness, you know, I think has over the last few years come into the limelight, obviously for certain issues and concerns in government. And then the others is because I think a lot of women, like you said, have become doctors now, especially in an OBGYN career, which kudos to, you know, a lot of the women following in your footsteps, because I think, you know, overall, a man wouldn't know how we feel and can't describe sometimes what we all know as a woman we go through every month. And I think, you know, you putting your doctor hat on and saying, well, what else can we talk about that is, you know, important to you, or is everything else okay monthly? You don't have that kudos with a male doctor. And I think the shift that you discussed before from the male generational legacy of what was early 50s to like 80s to now being yourself as representation of more women going into the field is actually helping prevention happen more often. And I think a lot of women are speaking up about their issues, which is, you know, a positive. I will give TikTok the only, you know, kudos out there is that when women are sharing stories about like, hey, I had my mammo or I had the follow-up, people are like, oh, maybe it's a reminder. It's like, maybe I should go too. But then you hear the stories of like, hey, I went to the mammo and they found something. And that something could be nothing after a follow-up of a certain, you know, few more results. I know every time I go to a mammo, and this is my personal history, is I always get a follow-up. I'm one of those people that like has dense tissue and they want to be extra, you know, thorough. And they send me for more follow-ups and more imaging. And I go, I know that is me. That is just my body type. But every time I get that second call, I go, okay, you know, let me do this. And then that third call, I'm like, okay, nothing found. I can continue life as usual. But I would definitely want to make sure that I get whatever bad news, if it ever is bad news, and catch it as soon as possible so that I don't have to then, you know, write a will to tell my people, like, here's what I could have caught earlier on. because I know there's so many women that have those stories of, I was just busy and life ran away from me that I didn't go for 3-4 years. And 3-4 years is a long time in medicine. I was like, women's wellness, especially because we've seen these environmental factors play such a role in our daily life that, whether it's genetics or whether it's, what we're eating or what we're ingesting, we don't know what that technically does to our, to our health internally. So catching it is so important. But also, to the degree where, life lessons about, being in OBGYN medicine and now having this extra obesity medicine as your expertise. How do you think those two will look down the line if you were to merge those perfect three together? What do you think is the life lesson that you want to tell everyone to say, hey, they're all very different sounding, and you may not be obese and you may not be old enough to go have a child yet, but yet we're all women. We all want to make sure women's wellness matters. What do you think is that message to say, start caring?
Women have been underrepresented for a long time in terms of their care and their needs, right? A lot of the studies were male dominated in terms of having their study figures being male and not focusing on that. And that's why we're seeing in the limelight now that heart disease, for instance, the factors or the signs of a male are very different than female, right? Now, I have to give kudos to the companies and institutions now that are making checklists. You want extra $200 gift card or something, from the company, you need to do this checklist, right? So that is pushing people to say, oh, no, I need to get the preventative, And I'm hoping as those years go on that incentive, is not the only thing that drives them, but it's a great thing, right? It incentivizes that we need to take care of who we are and be healthy in terms of finishing our job, taking care of everyone, right? The second part of that is that New York State, just recently, I think starting January 1st, is going to be giving also paid time for prenatal visits. So we as a whole and as a nation, or I should say more as a state now, have found it very important that us as females to go to our appointments, to make time for our appointments, that it's not taking out of our paycheck or cutting hours here. I need to, leave a half hour early here in order to be taken care of during my pregnancy as well.
Now, mark my words, if men gave birth, we would have paid leave every month.
Probably. That's a different story. We
would have at least a year off after childbirth.
Yeah.
It would be a different world.
Absolutely.
However, I think to get to that change, and I say this in every discussion that I have, not just medicine, we need to be at the table.
We do.
If we are not at the table, those guidelines or those tests don't have women's health or wellness as a conscious decision in them. In the 70s, and I may be mismarking the year, but when the seatbelt in a car was tested, it never had a pregnant woman in mind. Which boggles my mind how many women drive and are the caretakers for their entire family in a car. And that never was tested on a pregnant woman initially, and know how that will, be to the fetus. So that only came years later when dummies became pregnant women. So just that one concept of, one example of when a woman is actually tested in the study is something why women need to be at the table.
Yeah, and we're getting there.
Yeah.
And I think, like you said, TikTok and social media is a big arena for us to be vocal.
Correct.
This is bringing into light everything else. This is bringing out weight management. This is bringing out our menopausal symptoms. This is bringing out everything that was never said or is never brought up. So I think that over the years will kind of open and flourish. And, there's a big movement for now in terms of, menopausal symptoms, right? And what can we do with them? No, just because you're menopausal doesn't mean that there's nothing to do. Just suck it up. No, there's stuff to do. There's symptomology that we can take care of and manage with medications and other factors. Now, going back to what you were asking me in terms of weight management and obesity, obstetrics and gynecology, and how they would be, as the years go on, I hope to see them blend into one.
Yeah.
we can't see obesity just as obesity. Obesity really should be just a vital sign that we are able and comfortable to talk about. Just like I'm like, oh, Kathy, your blood pressure's a little high today, right? Oh, your cholesterol might be a little high. We need to get to that comfort level and say, oh, your body mass index, your BMI is a little elevated, and not take it personally that, oh my God, this doctor is telling me I'm fat. No, we're not telling you you're fat. We are telling you that with that BMI, you can be at increased risk.
Yeah.
And this should be weaved into the conversations. And it might take 1 visit, 2 visits, 5 visits, whenever this patient is ready to listen, right, and accept it. But we need to take that stigma off that obesity is just a you issue.
Yeah.
We need to accept that it's a multifactorial issue, and that with medicine, right, GLP-1s, or with guidance of the medical field, right, that we can achieve the weight loss, but also decrease risk factors, decrease complications in women across all stages of their life.
For sure. And I think, going back to something you've educated me on is prevention is key in all these factors. Mm-hmm. Whether you're the GYN or whether you're the OB or whether you're the, weight management doctor, prevention is key. And I think for everyone listening out there, please, at least do me a favor and go to your annual. I will make sure I will post Dr. Iman Saleh's information. And if you want to go and see her, please do find, we will link her contact and her accomplished bio on our podcast. But I think as a takeaway, one of the things I wanted to make sure everyone is aware of is women's wellness is not just these topics. Mm-hmm. There's so many more topics to discuss in women's wellness. And I will bring back Dr. Iman Saleh for further conversations down the road. And if you want a topic that is near and dear to your heart, please, let us know and we can take that under consideration.
Absolutely.
Whether it's, menopause or whether it's something else down the line, I think, she is the expert to bring back and talk about these topics down the line. If I could leave you with anything in mind, it's prevention is key. So if you haven't scheduled that annual, please go ahead and do so. And if any of this, is important to you or to your loved ones, let them listen to the podcast and see if there's something to take away, because you want to take away that generational issue and solve for it in your lifetime. So if you have obesity issues, you want to make sure it stops with you. Mm-hmm. If you have issues with infertility, obviously some of those are not solvable, but if they are, it could be because you just need to see a doctor that has that expertise. So on that note, we're going to say thank you to Dr. Iman Saleh.
My pleasure.
But we will also continue the conversation further. So listen in if you want to hear a little bit more. But if not, I hope you like and subscribe to the podcast going forward. And again, this is Kathy Inglad with the Top Lessons Podcast. Thank you, Doctor.
Thank you, Kathy, for having me.
Thank you.